Hi, Nikki. My name's Alana.
Nice to meet you.
Nice to meet you. I'll be your sign case manager today. I'm sure, did you sign the confidentiality agreement?
Yes, I did.
Okay. So that's just basically if everything that we say in here is between you and no one else hears about it other than if someone is going to be harmed or you're going to harm yourself, I have to report that.
Gotcha.
Okay. So, to start with, I just want to hear a little bit about yourself and what's been going on in your life that you're struggling with and whatnot.
Okay. So 3 years ago, I lost my father, and it was really hard on me, and I resorted to drugs, and I have been a addict now for the last 3 years. I have been seeing a psychiatrist. I'm trying to get help. It's slowly helping, but not all the way. I'm getting over the sickness of not having the medication in my system, but my mind still tells me that I want it. But I'm still continuing to see the psychiatrist, and she is helping me to try to get through this addiction.
Okay. Okay. So, what you're saying is like you pretty much went through the physical withdrawals?
Yes.
Okay. And you're just having like cravings now. You're kind of like your brain's kind of telling you that you want this and you got to go get it and whatnot.
Right.
Okay. So, are you still doing drugs or what's been going on?
As of right now, I've been 6 days clean, and it's a struggle, but I'm feeling better. I wake up with energy. I feel better about myself.
Yeah.
I don't have insurance, so it's kind of hard to go get extra help, which I could use.
Right.
But I have a fiance, and he's helping me deal with it as well to get me through my addiction.
Yeah, that's awesome, especially having that natural support with you to help you through it. Now, so back to first off, I'd like to say congratulations. 6 days clean is awesome, especially for being on drugs for 3 years. I mean, your entire brain chemistry changes, and all it wants is that drug. So to be able to just step away from it for even a tiny bit of time
Right.
is awesome. So
Yeah.
you should be proud of yourself.
Thanks.
Okay.
Thanks.
And so you're going to the psychiatrist.
Yes.
And what do they think about this?
They have me on anxiety medication to
Okay.
help me deal, and on a mood stabilizer to kind of try to deal with my mood so I don't isolate myself, so that the cravings kind of go away in my head. We talk about how I can better myself by not taking the medication, and by taking the anxiety medication, it keeps me calm and keeps me so I'm just not like freaking out inside.
Okay. So now, do you want to be completely sober from all drugs? No,
Yeah.
like, have you ever tried like Suboxone or Methadone or anything like that?
No.
Okay. Okay, but you want to be clean completely.
Right.
No other.
I don't want to be on anxiety medication. I don't want to be on mood stabilizers. I just want to go back to my normal self.
Okay, right. No, I completely understand. I mean, I agree. I think that it's best to get rid of it all, honestly. Now, how have you been the past few days? Like, have you been really struggling with cravings, and have you, thought about slipping up, or like what's going on in your head?
I won't lie, I have felt like slipping up. I've done a lot of crying. Like, I've laid in my bed and I just cry and just let it all out, and it helps in a certain way. And I just keep telling myself that I want to have children someday. I'm 32 years old with no kids, and that I can't have kids being an addict.
Right. I mean, and I praise you for that, because a lot of people they really don't care. When they have that addiction, it comes first, and for you to be able to see that is enough at first. Like, as long as you see that, you're gonna get there. You just have to motivate yourself and keep going, okay? So you shouldn't give up on that.
Right.
Have you ever gone to like a rehab or anything like that?
No.
Okay.
No. I have family support that's trying to get me through it.
Right. Well, that's awesome. I mean, as long as you have supports and you feel like you can do this, I just want to see, if you feel like you can do this on your own, then that's awesome. Then you should do that on your own. But I do want to keep that in the back of your head, if you feel like you ever just want, like, you really can't do it and you want to slip up, there's always an option of going to a rehabilitation center.
Right.
And it's not the best, but I mean, I know that a lot of people get nervous about being there for a certain amount of time or having to take time off of work or whatever that may be. But there's other options like, going to intensive outpatient, which is going there every day, but you don't have to just leave your entire life away. You know what I
Right.
mean?
Right.
And, I think that that should be in your mind that that's always an option if you can't do this on your own.
Right.
Because a lot of people try, and some people succeed in it because, they're determined and they're going to do it. And then some people, it takes a few times to do it.
Right.
Okay?
Right.
So, I know it's difficult. You said you didn't have insurance, and that definitely makes it hard to get, especially I'm sure the psychiatrist costs a lot, and seeing
Definitely.
me is a lot. But there are grants through the state of Maine that we can try and get you in there.
Okay. Okay.
So if you ever feel like you're really struggling and you slip up or you start getting back into it again and you're just so unhappy, don't just give up. You can always call me and I can make some referrals to get you in there, and I can look into trying to get you some grants, okay?
Okay. Okay.
So let's go back to like the boyfriend or the fiance, did you say?
Yeah.
Okay. How has he been about this whole situation? I know you've been crying and emotional, and that's something you're gonna have to deal with for a while.
At first, I tried to like not block him out, but I felt like, yes, he was supporting me, but in another sense, he was like driving me crazy because he was pushing so hard for me to keep going clean and keep going clean. And finally, I'm realizing that he's doing it to make me better and to better myself and make me feel better.
Right.
To quit.
Right. It kind of irritates you, but at the same time, he's doing it because he loves you.
Right. And I understand that. I understand that.
Right. But it's hard because you're trying to stay clean right now, and that's all your body wants. And when it's not releasing those endorphins because of the drugs, you take the drugs, they release endorphins that make you happy.
Right.
And when you're not getting those endorphins, you're very unhappy, and that's a symptom that you're going to have to deal with for a while, is depression and anxiety and all that. And it's awesome that you're going to a psychiatrist because they're going to help you with all that stuff.
Right.
And I want you to be really honest with them
Yeah.
about what's going on, because they're there to help.
Right.
Okay?
Right.
So what do you want out of this?
I want to be able to have children someday.
Mm-hmm.
And I know by me returning to be an addict, I'll never have that opportunity.
Right.
I mean, I have nieces and nephews that I love spending time with, and that I'm a good role model for them. And I want to have a child of my own, something that come from me.
Mm-hmm.
And I realize that being an addict, I'll never have that life.
Right. No, I understand that. Now, family is really important, and I can imagine, of course you want to have a good life with your husband and a family, and to be able to do stuff, you're not going to be able to do that when you're, not sober.
Right.
Do you think that coming to counseling would help?
I don't know as far as counseling goes, but as seeing I was seeing a doctor, but I felt like the doctor wasn't really helping me much. I felt like he was pushing more medication on me to try to control my moods and my depression and my anxiety.
Right.
By me seeing the psychiatrist, I was able to open up to her on a deeper level.
Right.
And explain the things that happened even in my childhood that I have never told anyone in my life.
Mm-hmm.
And I think by all the things that happened in my childhood led to my addiction, even losing my father so dramatically.
Oh, of course, yes. And I think that, if you're completely opposed to counseling, I totally understand that. But I think that talking about it and going in your past and understanding why it happened and what's happening and understanding these cravings that you're getting and having another support, of course it's good to have your family, but your family's going to get under your skin. You know what I mean?
Yeah.
It's kind of good to have someone else on the outside helping you figure out what's really going on.
Right.
So, personally, I would suggest that if you don't quite want to take that step into rehab, maybe that going to counseling on a weekly basis, or even, however, I know it's expensive, we can try and I can try and help you figure out if there's any way, try and find insurances or try and find some grants to help you out.
Okay.
But even if we have to do it once a month,
Right.
I think that coming in to talk to someone, to vent, and just, sometimes you just build it all up and it's hard to talk to your spouse
Right.
about it.
Right. Because I get frustrated with him because his opinion may be different than how I'm feeling.
Exactly. So, if you're not opposed to it, I would like to see you again
Okay.
so we can, go further into this. I know that we just kind of touched base on a few things or whatnot, but we can talk about everything, your father's death, your childhood, as long as you're comfortable with that, we can kind of start figuring things out and working through it.
Okay.
Because with all of that stuff, in the past, it's hard to build a future.
Right.
You know what I mean?
Right. Yeah, I do.
And you have to heal from that and recover.
Right.
So, it's totally up to you.
Mm-hmm.
But if you want to give me a call, I mean, you don't have to make any decisions right now. If you
Okay.
want to call, if you want to make an appointment again, then you're more than welcome to go out to the front desk and make an appointment with me.
Okay.
But if you don't, I'll write down my number for you, and you can give me a call personally directly to my phone,
Okay.
and we can set up an appointment.
Okay. And
To
what
talk.
we've talked about today stays between us.
Completely between us.
Okay.
Nothing
Okay.
nothing leaves this room, as long as, you're more than welcome to, you can sign releases, like for your husband or your, whoever, if you want them
Okay.
to, like, come in here, and even they're more than welcome to come in here and talk with you,
Right.
so they can understand where you're coming from, you know what I mean? We don't have
Right.
to talk about everything,
Right. Right.
but the things that are going on with them and you.
Okay.
So, so I will be waiting to hear from you.
Okay.
And if not, no pressure. I hope you're going to keep seeing the psychiatrist, right?
Yes. Yes.
Okay.
Yep.
Okay. And
I've actually seen her twice this month, so it's actually
Awesome.
been it's helpful.
Good. So you're going to keep seeing the psychiatrist. You can give me a call,
Okay.
and make an appointment. And you will have my number. I want you to keep my number because I can always get you into an inpatient, outpatient, anything. Okay? Don't feel like, when you're having a really rough day, don't just give up because, you just can't handle it. You can't take it anymore.
Right.
Call me, call Crisis,
Okay.
call anyone.
Okay.
Okay?
Yeah. Yeah.
All right. So it was awesome to talk to you.
Thank you.
I really hope to see you again.
All right.
Okay.
Definitely. Definitely.
Awesome.
Thank you.
Thank you, Nikki.
It was nice meeting you.